There's a growing public health concern in this country and very much right here in central New York.
About 2/3 of families at the Upstate Pediatric and Adolescent Center report being unable to afford enough diapers for their kids. So joining us now is Dr. Winter Berry, who just published an article in for the New England Journal of Medicine. Dr. Berry, thanks so much for being here. Really appreciate it.
It's a pleasure. Thank you.
Yeah, thank you for joining us. Let's first talk about the need. What have you seen in the last 5 or 6 years, and why have they become so unaffordable?
Yeah, so we've really seen an increase nationally. The prior statistics were 1 in 3 families experience diaper need, and more recently it's been 1 in 2. That increase is much more dramatic in the Syracuse area. When we first started recording our statistics, it was about 25% of families in our clinic, and in 2023 we found 2/3 of families, as you mentioned. I think the affordability probably is a multiple issue. So all goods are more expensive, and I think diapers go along with it. And then families who have need don't have as much cash purchasing power at one time. So each diaper gets more expensive, and if they can't go to big box stores and buy in bulk, that drives up the cost per diaper.
But what about government support? Are there programs out there that can help with things like that?
So diaper need is actually unique in that it's one of the costs to parents that doesn't have supports from government programs. So there are things like food assistance, housing, health care, but diaper costs are reliant on families' budget alone. And so families feel that crunch because diapers can be more than $100 a month for each diapered child they have.
There's a partnership now, Upstate partnering with the CNY Diaper Bank a couple of years ago. Is that helping to fill the gap? And how do Upstate nurses determine who benefits from the program?
Yeah, so we started partnering with the CNY Diaper Bank first, I believe, in 2017, and over time that partnership has grown. Because of their sustaining ability to provide diapers to us, we can now screen families up until age 4 at their well visits to see if they have need. And the nurses, while they're putting families in rooms, sort of say, do you feel like you run out before you can afford more? Or do you feel like you don't have enough diapers or can't afford enough to be able to keep your child clean, dry, and healthy? And if they do, they get diapers during their visit.
What do they get? I mean, is there kind of a typical, or it varies much, like you say, dependent on each family? Or do they get a set like 50 per month or something like that?
Sure, so exactly that. They get 50 per month, which was determined based on national and local surveys to figure out the gap families were having each month, and 50 was about the amount that they were short. And most of our families say that their gap is filled by what they receive from us per month.
I imagine you're seeing some pretty good results from this program, especially since you're hearing directly from families in need.
Yeah, absolutely. When families receive diapers, there's a QR-based survey we ask them to fill out on the diaper package itself, and the area-wide statistics show that between 70 and 80% of families have real positive outcomes from receipt, things like decreasing their stress, they feel like a better parent, their child is healthier, and then they can pay some other bills, things like buying more food for their family or paying another bill. So it really has a bigger benefit than just the diapers themselves.
And you've got a way for viewers to step up and help. Tell us about that match program.
Yeah, so the CNY Diaper Bank is having a matching donation going on now in honor of Diaper Need Awareness Week, which just finished up last week, but the matching grant goes through October 15th. So if you go to cnydiaperbank.org, it's got all the information about how to donate.
Maybe last one, I got time. I said tell me about 90 seconds. So the idea of publishing in the New England Journal of Medicine, the idea to help kind of spread this thing to I'm sure that's why people read these kinds of publications, especially when you're in the business kind of thing, so to speak. So publishing it, what are you hoping to gain there?
I think awareness is the biggest thing. I think the pediatric community has become more aware probably over the past 10 years of all influences of poverty, this being a specific one that, like I said, is a gap in the social safety net we have for families. So we're hoping the wide viewership of something like the New England Journal makes people aware outside of medicine, outside of pediatrics, that this is a need that families have.
And we're spreading awareness right now. Dr. Berry, thank you.
Thank you.
Thanks for coming.